Welcome to the deep dive. Today we're tackling a challenge many horse owners face: equine sinusitis. You might think it's just, a runny nose, something minor maybe, but we're about to show you why it's often far more complex and hidden sometimes. We've really dug into stacks of veterinary wisdom here to give you the insights you need, kind of cutting through the complexity to get to what really matters.
That's right. Our deep dive today, it's going to explore everything from spotting those sometimes subtle signs, navigating the diagnostic process, which can be tricky, and then really importantly, understanding the different treatment options and management strategies. It's a common issue, but it can get complicated fast if it's not handled right.
Okay, let's unpack this then right from the start.
Sure.
When we talk about equine sinusitis, fundamentally, what exactly is it?
Well, at its simplest, it's an inflammation of the perinatal sinuses, the sinuses in the horse's head. Now, that sounds pretty straightforward, but what causes that inflammation is, well, incredibly varied. You can have what's called primary bacterial sinusitis. This usually follows a sort of systemic bacterial infection, often something like streptococcus. But then you have the secondary causes, and this is where it often gets, more interesting and maybe surprising for some owners.
Ah, okay. So it's not always just a simple bacterial thing. What are these other, maybe less obvious triggers?
Not at all. What's really key here, I think, is that the most common secondary cause is actually dental sinusitis, which means the problem starts from an infection in one of the horse's upper molars, the maxillary molars, basically a tooth problem leading to a sinus problem. And the first molar seems to be a frequent offender. Then, less commonly, but still really significant, it can be caused by expanding masses within the sinuses themselves, things like cysts or even growths.
Growths. What kind of growth we're digging about there?
Things like neoplasms, basically tumors, or osteomas, which are bony growths, or even something called progressive ethmoidal hematomas. These are benign blood-filled masses, but they can get quite large. And then there's also mycotic infection, fungal infection, usually caused by Aspergillus fumigatus.
Right. One term that really jumped out at me from the sources was inspissated exudate. That sounds a bit intense. Can you break that down for us?
Yeah, it does sound a bit technical. So sinusitis often comes with empyema, that's just pus, really. But this exudate, this discharge, can become inspissated. Basically means it thickens up, becomes more solid. Sometimes it's described as almost paste-like or cheesy in consistency. And this thickened stuff, it most commonly forms in a specific spot called the ventral conchal sinus, the VCS. And remembering that detail is actually pretty crucial because, well, its presence and where it is directly impacts how you have to treat it later. You often can't just flush it out easily like liquid pus.
I see. So given all these different causes and this thick discharge issue, how do the different sinus areas connect? Does an infection in one spot really mean it can spread everywhere? And how does that link up with things like strangles or dental problems that you mentioned?
That's a really good point. Yes, the various sinus compartments in a horse's head, they all communicate. They're interconnected. So once an infection gets going in one area, it absolutely has pathways to spread. It means potentially all compartments can get involved. And you're right, it's a known complication of things like strangles, the contagious bacterial infection, or it very often goes hand in hand with obvious signs of dental disease. It just reinforces that tooth sinus connection we talked about. In terms of, how common it is, primary and secondary bacterial sinusitis are seen pretty much worldwide. Mycotic, the fungal type, that's less common, tends to pop up more in cool, damp climates. And interestingly, for the bacterial kind, there aren't really strong age, sex, or breed links across the board. However, when you dig a bit deeper, you do find some significant risk factors that influence who might be more likely to get which type.
That's fascinating how those risks align with the horse's age or stage of life.
Right.
So for an owner, knowing their horse's age and maybe environment becomes part of spotting potential risk, right?
Mm-hmm.
What are those key risk factors?
Exactly. For instance, younger horses, say between 1 and 5 years old, they're actually more susceptible to that primary bacterial sinusitis. And that's mainly because they're just more likely to encounter Streptococcus egrivar, Equidistrangles bacteria we mentioned. Then at the other end, older horses, they tend to have a higher incidence of things like infundibular caries, think deep cavities in the teeth, and periodontal disease, gum disease. Both of those are common roots for dental infections to start. And we also see neoplasia, those tumors become more common with age. And then there's the environment factor. Horses kept in stables a lot, or those who've recently had sinus surgery, they seem to be at higher risk for the mycotic, the fungal type.
Okay, that really clarifies why certain horses might be more prone. So let's switch to the owner's view again. What are the actual sort of red flags they might notice first? What makes them think, maybe my horse had sinusitis?
The single most common sign, really regardless of the cause, is nasal discharge. Purulent or mucopurulent, basically pus or mucus mixed with pus coming from the nostril on the affected side. That's usually the first thing. But, the details of that discharge can give you some important clues. For example, mycotic, the fungal infections, they sometimes cause a discharge with blood in it, sanguineous discharge. And if you notice a really bad smell, a malodorous exudate, that's almost always linked to either dental sinusitis, an expanding mass, or one of those fungal infections, whereas an odorless discharge is more typical of that primary bacterial type. Although even that can start to smell bad if the exudate gets inspissated, thickens up, and just sits there.
So the smell, the color, that can tell you a surprising amount. What about other signs beyond the nose? Anything else an owner or vet might spot?
Yeah, other common things include excessive tearing from the eye on the same side. That's called ipsilateral epiphora, conjunctivitis, so inflammation of the eye lining, and enlarged lymph nodes under the jaw, again, just on that affected side. And if there is an expanding mass growing in there, you might eventually start to see some facial distortion, like a bulge on the face, and maybe difficulty breathing through that nostril because the airflow is blocked.
And I guess it's worth repeating that a really good oral exam by the vet is critical, right? It might show that molar disease directly, or maybe a gap between teeth, a diastema pointing straight to a dental cause.
Absolutely crucial. And it's also worth remembering if you see discharge coming from both nostrils, that's actually unusual for sinusitis itself. It usually suggests a problem further back in the respiratory system, behind the nasal septum.
Okay, so an owner notices some signs, and it sounds like some can be pretty subtle. Maybe just the tearing or slight discharge at first. What's the next step? How does the vet confirm it's sinusitis and, crucially, figure out the root cause? What's that diagnostic path look like?
Well, often the basic blood work, CBC, biochemistry, urinalysis, comes back normal, which means you need other tools. Imaging is usually a critical first step. Radiographs, x-rays are used a lot. But they can be challenging because teeth and the sinus cavities have different densities. You often need multiple shots, different exposures, different angles to really see the detail properly. Usually you'll see the affected sinuses look more opaque, cloudy, and sometimes you can see fluid lines. But here's something really insightful for owners, I think. Even with good quality x-rays, if the problem is coming from a tooth root within the sinus, well, you can only confidently spot that on the radiograph about half the time. So if the vet takes x-rays and they look clear but the horse still has symptoms, that doesn't completely rule out a dental issue being the cause. It's a reminder that clear x-rays aren't always the end of the story. Further digging might be needed. Of course, more advanced imaging like a CT scan gives much more detail, but that usually means general anesthesia, which has its own risks and costs.
That's a really important point, that negative x-ray doesn't always mean no dental problem if the signs persist. Owners need to know that. So beyond imaging, what other diagnostic tools might a vet use?
Right. Beyond imaging, the vet might do percussion tapping on the horse's face over the sinuses. A dull sound where it should sound hollow can indicate fluid or a mass. The oral exam, as we said, is absolutely vital for checking the teeth. Then there's endoscopy. Rhinoscopy lets you look up the nose to see discharge draining from the sinuses or maybe see distortion if there's a mass pushing things around. And then there's sinoscopy. This involves making a small hole, a tricking hole, into the sinus. It allows the vet to put a scope right inside and see things directly the exudate, maybe a mass or those fungal plaques. Getting a look into that ventral conchal sinus often needs another small surgical step to actually break through into it to see and maybe clear out that thickened material. And finally, you look at the exudate itself. Cytology and culture. This is really where you pin down the cause. Lots of different bacteria usually points towards dental disease or maybe a mass. A single type of bacteria, after that hemolytic strip, suggests a primary infection. And finding fungal elements under the microscope, plus getting a heavy culture of a pathogenic fungus, well, that confirms a mycotic cause.
Wow. Okay. So a lot goes into figuring out exactly what's going on.
Yep.
So what does this all mean then for treatment? Once you have that diagnosis, what are the actual goals?
Well, the goals depend on the type. For primary sinusitis, the main aim is to clear the infection with the right antibiotics and, really importantly, to physically get that exudate out, lavage, flushing it out. For secondary sinusitis, the absolute number one priority is fixing the primary problem. Whether that's sorting out the bad tooth or removing the mass, you have to address the source. So for primary bacterial sinusitis, the usual approach is flushing the sinuses, lavaging them with sterile fluid, combined with systemic antibiotics, usually injections. The bacteria involved are often sensitive to things like penicillin or related drugs. The lavage itself, you create small openings, portals into the sinuses, flush fluid through, and it helps wash out the infection. The fluid then drains out the nostril.
And what happens if that initial approach, the flushing and antibiotics for bacterial sinusitis, just doesn't seem to clear it up?
Ugh, good question. If it doesn't resolve, that's when you strongly suspect that inspissated, thickened exudate, probably stuck in the ventral conchal sinus, and that stuff has to be removed. This usually needs surgery, often done through what's called a frontonasal flap. The good news is this can frequently be done with the horse standing, sedated, which avoids general anesthesia. The surgery gives direct access to get that solidified gunk out. Now, for the mycotic type, the fungal sinusitis, treatment usually involves lavaging the sinuses, but this time with antifungal drugs, things like itraconazole, fluconazole, miconazole. This might go on for, say, 1 to 2 weeks. And then for secondary sinusitis, the ones caused by teeth or masses, the underlying cause must be dealt with, and yeah, that very often means surgery. If it's a dental infection, that almost always means removing the infected tooth.
Removing the tooth. How is that usually done? Is it a major ordeal for the horse?
Well, there are a couple of ways. Taking it out through a small hole drilled in the bone above it or via a bone flap often has fewer complications and, again, can frequently be done standing. Trying to punch the tooth out from below, which is called repelling, that tends to have more potential complications and usually needs general anesthesia. It's also important for owners to realize you can't just remove these upper molars through an incision in the cheek, and trying things like root canals on these teeth is often ineffective. Thinking about specific drugs for that primary bacterial pus, procaine penicillin injected twice a day is pretty standard, along with the flushing. For fungal infections, vets might also use systemic sodium iodide for a few days, then switch to an oral organic iodide, continuing until the signs clear up.
Okay. Are there any really important warnings or situations where those drugs, like the iodides you mentioned, absolutely shouldn't be used?
Yes, absolutely critical point. Sodium iodide and the organic iodide should never be given to pregnant mares. They can cause serious side effects for the mare, things like excessive tearing, hair loss, coughing, and for the foal, it can potentially cause abortion or the foal being born with thyroid problems, hypothyroidism. So yeah, definitely not for pregnant mares. Careful history taking is vital.
Good to know. So once the main treatment, whether it's lavage, surgery, tooth removal, is done, what kind of aftercare are we looking at?
Post-treatment, you're usually looking at supportive care, things like NSAIDs, non-steroidal anti-inflammatories for pain and inflammation. And restricting activity is important too, usually for several weeks after the signs have gone, just to allow everything to heal properly. Monitoring is obviously key. You want to see that nasal discharge continue to resolve. If there was facial swelling from a mass, that should gradually go down over weeks after it's removed. One interesting thing, though, is that even when the horse looks clinically normal, the sinuses might still look opaque, cloudy on x-rays for quite a while after. So clear radiographs don't necessarily mean everything's instantly back to baseline internally, even if the horse seems fine.
It really is fascinating how specific the diagnosis and treatment pathways have to be. If we try and connect this back to the bigger picture, are there ways owners can actually prevent some types of sinusitis from happening in the first place? What can they do?
Yeah, prevention really focuses on two main areas. First, vaccination. If strangles is common in your area or on your farm, vaccinating susceptible horses against S. equi can definitely help reduce the incidence of that primary bacterial sinusitis. And second, and this is huge, routine dental care. Regular checkups, floating, addressing any issues early, this can dramatically cut down on the dental disease that so often leads to secondary sinusitis. It's probably the single most effective preventative measure for that common type. And beyond those two big ones, just good general husbandry helps, right? Things like good stable hygiene, trying to minimize dust, ensuring good airflow in barns. It all contributes to better respiratory health overall, which can indirectly lower the risk. And, just being observant. Noticing those subtle early signs, a bit of discharge, maybe slight facial asymmetry, and getting the vet involved sooner rather than later, early action can often stop a minor issue turning into a major surgical case. Now, unfortunately, sometimes treatment isn't successful. For primary sinusitis, when it fails, it's usually because some of that inspissated exudate got left behind in the VCS. For dental sinusitis, failure is often due to ongoing infection from little bits of bone or tooth left behind after extraction, or sometimes, again, retained inspissated exudate. But, on a positive note, the long-term outlook for horses with primary or dental sinusitis is generally really good if they get the right treatment in a timely way. Early intervention really is key.
We've definitely covered a lot of ground here, from those first subtle symptoms
Right.
through the sometimes complex diagnostics and into these very tailored treatments for equine sinusitis. It really highlights the precision needed in veterinary care and how much our horses rely on us noticing when things aren't quite right.
Absolutely. And maybe as a final thought for everyone listening, reflect on this. Given how subtle the start of sinusitis can be sometimes, how might a deeper awareness of your own horse's normal behavior, those little changes in nasal discharge or even facial symmetry, empower you to catch things earlier? Could that early intervention potentially head off the need for more complex, maybe surgical outcomes later on? It's just a reminder, isn't it, that being truly well-informed is this ongoing process, observing, learning, and being proactive in caring for our animals.